Seems like we're getting bombarded with an endless list of death counts, mortality rates, and case numbers. But amidst the global coronavirus pandemic, there are still a few success stories. We've all heard about flattening the curve. That is, reducing the speed at which cases multiply so that the hospital system doesn't get overwhelmed. So how did South Korea, a country that suffered a major outbreak, actually manage to do this compared to other countries who couldn't? In a 3-week period between February the 13th and March 4th this year, Iran, Italy, and South Korea all experienced huge case spikes in COVID-19, with South Korea passing 5,000 cases. All 3 outbreaks could be traced back to events that massively accelerated infections. In Italy, a soccer match at a stadium in Bergamo. In Iran, holy sites in the city of Qom. And in South Korea, a church. A month later, Italy and Iran were experiencing total disaster. But South Korea had somehow managed to pull itself back from the brink. How did they do this? To understand how a country contains COVID-19, we need to understand a few basics first. It's common sense that people with symptoms should be isolated, but when it comes to coronavirus, that simply isn't enough. Because with this virus, people who seem fine and asymptomatic can still go around infecting people. This is why social distancing is crucial, because at any given time, we don't know exactly who has the virus and who doesn't. And minimizing contact between all people is the best defense against infection. This also means that testing people without symptoms is really important, so people can know whether or not they're carriers and need to quarantine themselves. So, what did South Korea do when they found themselves in the middle of a rapidly escalating outbreak? Authorities identified a religious group as a major source of the outbreak, quickly imposing emergency measures on its 4th largest city and a neighboring town as special care zones. Residents were asked to avoid travel, stay home, and wear masks even inside their homes. By late March, South Korea had a per capita infection rate much higher than the US. But it had also administered over 300,000 tests, a per capita rate almost 40 times higher than the US at that time. South Korea opened 600 testing centers, including 50 drive-through stations where tests take around 10 minutes and can provide results in a few hours. While testing is not the only difference between South Korea and the US, you can see the difference in the rate of case increases here, again adjusted for differences in population size. South Korea employed consistent, widespread public messaging about preventative measures, symptoms, and testing. Offices, hotels, and even restaurants used thermal image cameras to check temperatures before allowing people entry. These things didn't happen overnight. In 2015, South Korea experienced a deadly outbreak of MERS, so-called Middle East Respiratory Syndrome, which led to the introduction of many of these measures. South Korea has been held up as an example of how a pandemic can be fought, without resorting to the kind of heavy-handed lockdown and curfew measures employed by China and others. But it still required far-reaching state powers to pull off the kind of containment it was able to achieve in such a short time. During a pandemic, case tracking and tracing is crucial. That means not just finding out who has the disease, but going back and checking who they may have been in contact with, so that they can also be isolated. Without case tracking, many of the people an infected person comes in contact with can go on to become infected or asymptomatic spreaders of the virus themselves. In South Korea, health officials have the power to track infected people's movements via credit card information, CCTV footage, GPS data from vehicles, as well as mobile phone records. People are also alerted by phone when positive cases appear in their area, so they can check whether they may have been in contact with an infected person. These measures are relatively cheap, and it's easy to say they could easily be adopted by other countries. But it's not that simple. South Korea is a country with a population that already had experience with a major disease outbreak. Their massive surveillance infrastructure requires citizens to relinquish a level of privacy that people in other countries may not be ready for. South Koreans also have good technical literacy and access to high-speed internet. Healthcare in the country is also nationalized, making testing and care affordable, ensuring that cost doesn't present a barrier to people who need tests or treatment. This is in stark contrast to countries like the US, where the fear of medical costs has prevented many from going to hospital. But the key factor for any successful intervention against a pandemic is obvious: time. South Korea is proof that it is possible to flatten the curve, but only if governments and the public have a shared understanding of the crisis and infrastructure in place. Unfortunately, for some countries, the response has simply been too late.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape, though. We have 11 cases, and many of them are in good shape now.